Welcome back, everyone. It's my pleasure to hand things over to Dr. Jerry McGill, the Vernon F. Gallagher Chair for the Integration of Science, Theology, Philosophy, and Law to facilitate the next session of our program.
Good afternoon, everybody. It's great to be part of the program today, and it's my honor to introduce the next two speakers, Beth Hoffman and Pamela Walk. Each of the speakers will have 10 minutes following one another, and then we will have 10 minutes discussion together. So let me begin to introduce Beth Hoffman, who is a doctoral student at the University of Pittsburgh Graduate School of Public Health. And Beth has been research assistant in the Center for Behavioral Health since just for over a year now, and has a remarkable vita already established, being the Graduate Student Research Award, being honoured with that in 2019 and 2020. She has had a lovely number of publications on a variety of topics, from prime television shows on social dynamics with cigarettes and e-cigarettes, use of social media and depression, and so on. It is my great pleasure to introduce Beth.
Hi, and thank you so much for that great introduction. I'm excited for the opportunity to talk to you all virtually today about the plethora of COVID-19 related misinformation and what we can do to try to curb its spread. Information and misinformation about COVID-19 has been spreading rapidly, especially through social media, leading the World Health Organization to declare in February that we're fighting an infodemic. When thinking about the cause of this proliferation, one thing I'd like to highlight is that this is the first pandemic in the age of ubiquitous social media use. During the last WHO declared pandemic, that was in 2009, the H1N1 outbreak, only 36% of US adults used at least one social media site. And today that percentage has doubled to 72%. Before we get started further, I wanted to cover a few key terms you might be hearing today. The first is misinformation, which is false or inaccurate information, and it's not always malicious in nature. Disinformation, however, is a little different. This is misinformation or untruths are spread intently. And the infodemic comes from a combination of the terms information and epidemic, which is exactly what it is. And it spreads much like an infodemic. As we saw earlier, we even have super spreaders, similar to how we've been seeing super spreaders with COVID-19. And looking back, it's easy to see why we have an infodemic. Because this is a new pandemic, there has been a lot to learn about it over time and quickly. Earlier messaging from January and February was that the flu was a greater worry for the US than COVID-19, which was true at the moment. But that's also the kind of messaging that was spread and over time morphed into COVID-19 is not a serious disease. Another example is masking. Earlier in the pandemic, the CDC recommendation was that the only people who should wear face masks were those who were sick or taking care of those who were sick. It was explicitly stated by the CDC that the general public need not wear a face mask. However, this has since changed as we've learned more about the virus and how it spreads through the air. But unfortunately, this prior information is now being used as evidence of incompetence of public health and medical professionals. Before talking more in depth about COVID-19 related misinformation, I'd like to take a few minutes to talk about science denialism more broadly. And the framework I present here was first published in 2009 and outlines 5 characteristics of science denialism. They include conspiracies, fake experts, selectivity, impossible expectations, and misrepresentation and false analogies. Previous research suggests that these tactics have been used to spread misinformation about topics such as Ebola, the safety of e-cigarettes, and alternative medicine. And this misinformation has translated into real-life harms, including instances of hostility toward health professionals working to control the Ebola epidemic. And of course, these tactics have been used to spread misinformation about vaccines, causing decreased vaccination rates and outbreaks of vaccine-preventable diseases. Last year, my colleagues and I published a study that looked at individuals known to express anti-vaccine sentiment on Facebook. Overall, we found Individuals Against Vaccines are not a monolithic group who all believe the MMR vaccine causes autism. And here you can see the results of our social network analysis, which found that anti-vaccine topics and individuals fell into 4 subgroups: lack of trust in the medical profession, touting alternatives to vaccines such as homeopathic remedies, concerns about vaccine safety, and conspiracy theories. Coming back to the science denialism framework, this is a graph from Nature News published in May. The orange lines refer to misinformation about COVID-19 concerning authorities, which fits into both the fake experts and impossible expectations categories. For example, as I noted a couple of slides ago, early messaging around flu and masking being cited as proof that scientists are not to be trusted. Similarly, the conspiracies, as well as false analogies and discredited or non-medical authorities, including our president, touting unproven cures and misrepresenting scientific statements in ways that can lead to harmful consequences, including death. One of the most visible examples of COVID-19 misinformation is the Plandemic video, which circulated on social media back in May. And as you can see from the graph on the right, published in the New York Times, this video, which featured discredited scientist Judy Mikovits describing COVID-19 as a conspiracy among those trying to profit from vaccines, is that many people who don't normally believe or share conspiracy theories were taken in by it. I know people in my own network who were sharing it, and I heard similar stories from other scientists as well. We've also seen targeting of COVID-19 misinformation at minority communities, particularly at so-called Black Twitter. And this is particularly concerning given a recent survey that found Black respondents were more than twice as likely as white respondents to say they trust social media as a source of COVID-19 information. And this is particularly problematic when thinking about COVID-19 vaccine acceptance. These are results from a survey published in a Lancet journal last month that found that whereas 68% of white respondents would agree to be vaccinated right now, only 40% of non-white or Black Americans would agree to be vaccinated. And actually just today, there was a great piece in the New York Times talking about recruitment of Black individuals here in Pittsburgh for COVID-19 vaccine trials, and I encourage you all to check it out. So before finishing up, I just want to offer a framework for thinking about how we can help combat the spread of COVID-19 misinformation. And my coworkers and I came up with the ABCs of treating the infodemic that hopefully will provide us with a framework moving forward. So the first is to be active on social media. So for those of us in public health and political science, really anyone, to be active on social media, delivering clear, concise recommendations and helping others navigate the plethora of information on social media. The B is borrow from influencers. The public health and medical communities are at a disadvantage in competing for attention and reach on social media. Dr. Jerome Adams, the US Surgeon General, has several 100,000 followers on Twitter, which is a lot, but nothing compared to the actor Tom Hanks, who recovered from COVID-19 with over 16.5 million. And you can see here an ad promoting the Pass the Mic campaign, which did just that back in May. It began with Dr. Anthony Fauci taking over Julia Roberts' social media accounts. And we can also think about this right here in Pittsburgh, particularly with sports stars. Someone like Franco Harris might be great for older people, whereas others such as James Conner or Juju might appeal to younger audiences. And finally, the C in our ABCs is to counteract misinformation. The nonprofit organization Shots Heard Around the World was started here in Pittsburgh and includes a global network of pro-science advocates. Its mission is focused on vaccination, and with COVID is continuing to grow. So I encourage anyone who's interested to visit their webpage and sign up to be a part of their network. And as discussed in the last presentation, the United Nations has also launched a campaign to counter COVID-19 misinformation. Anyone can sign up here at the website to become a digital first responder. And according to their website, more than 10,000 people have signed up around the globe. And then also the United Nations Take Care Before You Share campaign, which acknowledges that right now emotions, especially fear, are running high, making us all more vulnerable to sharing misinformation. This campaign urges us all to pause before sharing information. And the website listed here consists of videos, graphics, and colorful GIFs that stress these points and are in a variety of languages and can be tailored to a variety of audiences. And that's it from me here today. So I'll turn it over to my co-presenter. Thank you very much.
Beth, thank you very much. Let me now introduce Dr. Pamela Walk from Duquesne University's Media Department, where Pamela is an assistant professor. Pamela obtained her PhD in mass communication, obviously very relevant for our topic today, from Ohio University in 2015. She has extensive journalism experience with the Pittsburgh Post-Gazette and so on. Multimedia journalism is an expertise that she carries forward towards our conference today. I just want to flag that her new book that's under contract is called Voices of the Pittsburgh Courier, and it will be due out from the University of Pittsburgh Press in 2022. Pamela, it's great to have you here. It's an honor to introduce you. Please proceed.
Thank you so much. Thank you so much. For my presentation today, I really want to look at misinformation from a historical perspective. Why does misinformation spread? How does it spread? We've been talking about that today. What role does journalism and media play in this? And how does that impact vulnerable populations? These all seem like very modern issues, but the reality is that misinformation is a pretty timeless phenomenon. Thucydides once observed that, quote, "So careless are most people in the search for truth that they are more inclined to accept the first story that comes to hand," end quote. So I plan to briefly use some examples from a century ago when the Spanish flu was ravaging our country to look at how newspapers, the dominant media of the day, reported the epidemic in hopes of shedding light on today's coverage, and then also address some steps that we can take in really practical ways in our everyday life to help curb our own culpability in spreading misinformation, particularly on social media. So first, we're going to take a look back in time. These are some PSAs posters that were published in 1918, and they were created in direct response to the Spanish flu, or what we know as the swine flu, or H1N1 today. On the far left and on the far right, you can see posters that were heavily circulated in Philadelphia, beginning in the fall of 1918. At the time, it was believed that spitting was a contributing factor to the widespread of the illness. And there were a lot of differing theories about where the epidemic started, but it reached Philadelphia in early September 1918 after infected sailors from Boston came to the Philadelphia Navy Yard. Once patients began appearing in hospitals, it became apparent how ill-informed and ill-prepared the city was. And accelerating that devastation was the city leaders' refusal, against the advice of medical experts, to cancel a rally for the Fourth Liberty Loan Campaign, which brought 200,000 Philadelphians together on Broad Street on September 28, 1918. Within 3 days, the incubation period for the virus, the number of cases skyrocketed, and the epidemic in Philadelphia eventually claimed 16,000 lives, 12,000 of those deaths occurring in a 5-week period immediately after that war bonds parade. And so we find that Philadelphia was actually one of the hardest hit cities in the US 100 years ago. Today, we see similar efforts to raise public awareness. Earlier this year, the Viral Art Project launched an effort to raise awareness of COVID-19 and called on graphic designers, artists, and creative people from around the globe to bring their talents to the coronavirus emergency. Designers were invited to submit poster art that raised awareness of the challenges facing all of us and to promote messages about what we could do to help. What I found really interesting was that many of these posters really reflected these iconic images from over a century ago. In particular, Uncle Sam, instead of wagging a finger, wagging a tape measure at us. From a news coverage perspective, 1918 was a pretty big year for news coverage. So while cities were using PSAs to help educate the public, newspapers were documenting the spread of the virus. Here are just a couple examples that I found from the Pittsburgh Gazette-Times to the New York Times, documenting headlines from Pittsburgh to San Francisco, basically about the spread of influenza, or what they called the grip. In San Francisco, it was interesting, this Friday, October 25th article in the New York Times, we see that the city was actually mandating masks for everyone in the city, and if they were individuals were caught without a mask on, they could face up to a fine of $5 to $100. According to the U.S. Department of Labor's Consumer Price Index calculator, that's about $82 to almost $1,600 in today's money. So they were very, very aggressive in terms of trying to curb contain the virus, and also to encourage people to wear face masks. And while newspapers during this time were not writing stories about hoaxes, this was a really common trend just a few decades earlier during the penny press and yellow journalism era in the US. But advertising was very much unregulated and unchecked. So in the fall of 1918, products from malted milk to Pappy's Cold Compound and Dr. Jones's liniment, which I think essentially was beaver oil, were hawked as sure cures for the Spanish flu. And what's really interesting about this collection of advertisements and trying to, make money off of what was happening with an epidemic, there was also the appearance of these advertorials, right? So they're advertisements designed to look like news stories, but they're actually paid content. And in the far left, we see an advertorial that's warning druggists that Vicks Vapor Rub is going to be in short supply and urging people to place their orders immediately. A century later, we see news outlets following every aspect of COVID-19, from the first outbreaks and running infection rates in the US to the politics behind the virus. I think what's different 100 years later is that these headlines are not in competition for public attention with a world that was at war, much of what was happening in 1918. It should be noted, though, that many of these news organizations had implemented paywalls, meaning readers had to pay for subscriptions to gain access, but pulled them down for COVID-19 related stories as a service to provide information to the most people. And because basically newspapers' role in society is to provide a public service through information. But these headlines and news stories did have competition, and still do, for audience attention. And a lot of times it's in the form of websites that purport to be unbiased news sources. This is just a sampling of quote unquote news stories that were published earlier this week from websites on the far left and the far right of politics in our country today. And like many of you, I've seen friends and family post to Facebook and Twitter links to many of these quote unquote news sites and a lot of other ones that are out there. And each time I see them, I'm often, debate with myself whether to respond with context on the agendas of the organizations that they're sharing, or links to more balanced reporting. Depending on the time that I have during the day, I will engage, and sometimes I don't. But the bigger questions are, how and why have sites such as these gained purchase in modern society? I think the problem is a number of things, but to shed some light on it, a newspaper research journal article in 2018 by Finneman and Thomas addressed in it the history of hoaxes and fake news, and noted that some of the biggest hoaxes in press history more than a century ago were really plausible only because, quote, readers' isolation and lack of education made fooling them easier. The researchers noted, quote, the rise of fake news in its current form in the 2010s was made possible due to the rise of the internet as a source of information and the availability for anyone to post content online to reach an audience. By the time of the divisive 2016 presidential election, 77% of adults using the internet use social network sites, compared to only 16% in 2006. As a result, millions of people are now able to share content widely without prior fact checking, end quote. The result is that someone with training and credentials of a professional journalist can reach audiences literally the size of Fox News or CNN or even the New York Times. Finneman and Thomas argue in part that some of this online activity is because consumers are reluctant to pay for news. So they opt for whatever they can get instead, which puts a public demand on information regardless of its accuracy. In the landmark book by Bill Kovach and Tom Rosenstiel, The Elements of Journalism, What News People Should Know and What the Public Should Expect, the authors argue that citizens have rights and responsibilities when it comes to the news, even more so as they become producers and editors themselves, meaning that as consumers and essentially producers, when we share information, we each have an obligation to make sure that we take care in the information that we share within our sphere of influence. So all of this sounds really dismal, but I think there's some simple steps that we can take, and they really support what Dr. Carly said earlier about our collective responsibilities of sharing information online. I think that arming ourselves with media literacy knowledge and being aware of our own biases, also just in the panel before ours, being skeptical and vetting information before sharing. And I think ultimately we have an opportunity to be part of the solution. So I want to leave you with some resources that I find really helpful in terms of just for sharing information. The first one is the Poynter Institute. Dr. Carly referenced this, but the Poynter Institute is currently offering free programming on media literacy. And they have 3 different tracks that are available right now. One is for Gen Z, one is for first-time voters, and one is targeting senior citizens. And it's a free training seminar that basically arms each of these demographics with tips and techniques to break through the noise and make better choices when they're sharing their digital media. The National Association for Media Literacy Education is a great resource for educators and parents alike. I know one of our questions earlier from the audience was, should we not be teaching awareness? And this is a great resource for everyone from kindergarten through college on ways to protect our digital natives against misinformation. And then the Local Media Association is a really great opportunity for media practitioners to kind of get outlet like tips on how to best share information in the digital sphere and some of the best practices that keep audiences in mind in terms of sharing those clear and concise messages that the presenter before me was talking about. I think I offer these as a way of encouraging each of us to be better information consumers so that we can help others to do the same. And just thank you for your time.
Pamela, thank you very much for a very interesting presentation, very thought-provoking. So we have 10 minutes now to talk together with you, and the chat box will start to relay questions from the attendees. But let me begin with a question to each of you, if each of you could address it, beginning with Beth and then going back to Pamela. A theme that I'm hearing resonate with our previous speakers and with both of you is the word public. It's all very well us talking to ourselves within our own little bubble. Of course, we are going to have media literacy, and we're going to be attentive to our biases and skeptical and so on. We know that we're trained to do that. But how do we get the public to develop those traits? From the perspective of health, Beth, could you maybe give us a sense of maybe in our society, I'm wondering, our society is individualistically oriented because of medicine being a one-to-one arrangement, but public health is trying to say, no, it's public, it's social. And then I'll reverse that question to Pamela in terms of not so much what can we do as individuals, but what can newspapers do, the established main press newspapers do to promote public good? Beth, would you like to take the question to begin with?
Sure. So one of the things is that I think in our health professional training schools, whether it be medical school, nursing school, even public health schools, we really need to be teaching these emerging professionals not only how to communicate with people one-on-one, but in the public domain. So first, teaching people how to communicate science to the general public, to share results of research studies they may be conducting, or to offer insight in a way that's digestible and clear. And also, we have an emerging generation of health professionals that has grown up in this digital age and is very social media savvy. So teaching them how to leverage their virtual voices to communicate beyond the exam room.
Thanks, Beth. Pamela, would you like to take the question in terms of the mainstream media, newspaper media in particular, how they can develop a sense of public responsibility?
Yeah, I think that, from a historical perspective, as a journalism historian, it's hard for me not to think back to the days of Pulitzer and Hearst, where they actually would have columns on how to be an American that was published in their newspapers. And I think that in some ways, mass media outlets and platforms have the opportunity to really engage in media literacy and, in encouraging readers and audiences to think about their own level of media literacy and how to improve on that. I think that, frankly, with a lot of newsrooms that have suffered so many losses in terms of staffing and, being asked to do more with less, those sorts of things really become much more difficult to implement.
Thank you. We have a great question from one of the attendees that each of you could maybe speak to from your own perspective. Should we encourage a new movement, an information volunteerism movement? Beth, let's go with you.
Yeah, I absolutely think we should. And that's one of the reasons I wanted to promote Shots Heard, because they are doing a great job activating individuals. And myself and some of my colleagues have been working with them on how to provide training, because I really agree with Pamela and some people have mentioned this in the chat that media literacy is really sort of underpins all of what we've been talking about today.
Pamela, would you like to address that? Volunteerism as a new movement?
I think that anything that helps people make better informed decisions when they're sharing information online is a good thing, right? And if people are, properly educating themselves and training themselves, if they're using those verification programs to kind of set a standard in their digital sphere of influence, then I say the more you know, the better off it is, right?
Another great, thank you, Pamela. Another fabulous question. We'll finish this with a comment from each of you because we're almost out of time. But Thanksgiving is not too far away and families will be round the table and the various old jokes will be there. But what do you suggest from each of your perspectives? How can we try to work within our families, not at the macro social level, but at the micro level of our families where we know there are deep divisions on either side? How can we foster this level of trust that we've been talking about today within our families? Beth?
I think that's a great question. And I think a lot of it goes back to being a good listener and also asking for why. I think, myself included, we all come to the table with biases and preconceived ideas. And so I think taking a step back to say, well, why do you believe that? Or, where did you see that? And then, sort of recognizing what, at least in my prior work on vaccine acceptance, we talk about vaccine hesitancy and vaccine resistant. And hesitant confers a level of being able to sort of move the needle, whereas 1 to 2% of the population is just completely resistant. So I think, recognizing what is the most sort of bang for our buck, and also, if we're talking about something like Thanksgiving, recognizing that it may just be that, we live in a divided time. So, it's good to have good conversation, but also keeping in mind the idea that, we can disagree with each other. And it's just important to try to be respectful and challenge misinformation when it is misinformation, but when it's not, just respect differing opinions.
Thanks, Beth. We are out of time, Pamela, just now, so maybe we could get your input on that question later in the discussion this afternoon. So let me pass it back, saying thank you very much, Beth and Pamela, for wonderful concepts, great inspiration and ideas. Back to you, Darlene. Thank you.